Good morning, dear guests, colleagues, President and Secretary of the Sri Lanka College of Health Informatics. It's an honor to be here and present our research to you all today. Our research focused on acting as a spark for the Open Data initiative in the Sri Lankan healthcare system and moving towards a transparent healthcare system that provides the benefit of the Open Data initiative to the scientific community, administrators, and the general public by creating an open data portal for the Ministry of Health. Open data is defined as data that can be reused and distributed by anyone with minimal restrictions. While the global healthcare system is expected to generate more than 25 petabytes of data and growing, the Sri Lankan healthcare system also generates vast amounts of data that will continue to grow. Unfortunately, this data ends up in data silos and never gets published to the scientific community. The graph on the left shows the rapid growth of data shared as open data starting from 2011 to 2021. On the right side, it shows the projected health information systems in the Sri Lankan healthcare system according to the Digital Health Blueprint, which shows the systems that will accumulate large amounts of data in the years to come. In this research, we adopted a design science research methodology which includes three cycles. A relevance cycle, where data is collected using a questionnaire to identify the need for an open data sharing. The study population included medical officers, administrators, and from the academia. And the second cycle, the rigor cycle, included a thorough literature review which studied existing knowledge on open data sharing, existing open data portals, and standards. The results of the relevance and the rigor cycle was then fed into the design phase or the design cycle to develop the open data portal. The diagram shows the design science research methodology. As you see, it's a cyclical approach of iterative development. When it comes to the results, it was identified that 48% of the study population had a positive attitude towards open data sharing, while only 14% of the population didn't agree with the concept of open data sharing. And 67% of the population agreed that open data sharing can accelerate scientific research process. And finally, 64% of the participants agreed that there's a clear need for Sri Lanka to have an open data portal to share healthcare data. The final result of our research is the Open Data Portal that was developed by using open source software and following the European Open Data Sharing Standard, and the Open Data Portal initially published 51 datasets obtained by the Medical Statistics Unit of the Ministry of Health. And the system was launched on the internet at the data.health.gov.lk web address. The datasets included data up to 2018, which was anonymized and published for the global scientific community. And in March 2023, it was launched by the Director General of Health Services. In conclusion, there is a need for sharing open data from the healthcare system of Sri Lanka that would benefit the global scientific community, and the open data portal that we launched as a result of this research provides a standard platform following globally accepted standards in open data to share similar data in healthcare systems. In future, an evaluation is needed of the open data portal that was created as a result of this research, and future iterative development should be carried out to meet the rapidly changing open data landscape. And we also suggest, in conclusion, to adopt global open data sharing standards to make sure this data that we publish is accordance with the globally accepted open data sharing standard. Finally, I would like to acknowledge supervisors of this research, Dr. Palita Karunapema, Director Health Information Unit, Dr. Pamela Sivantana from the World Health Organization, and Dr. Sridharan, DDG Planning, who helped obtaining data from the Medical Statistics Unit, and as well as helping all the administrative work that needed in launching this open data portal. And I also would like to thank authors of this abstract, Dr. Santarangala from the University of South Australia and Dr. SKP Fernando from the Ministry of Health Sri Lanka. And finally, the Medical Statistics Unit of the Ministry of Health. And thank you.